Hey everybody, we're going to go ahead and wait about 2 minutes here. Still got some people logging in. Want to make sure that we give ample time for everybody to get logged in, and then we'll go ahead and get started in less than 2 minutes. All righty, it is 2 o'clock here, so we'll go ahead and get started. Good afternoon, everybody. This is Tyler Finken. I'm the Health Marketing Director over at Western Marketing. Just want to say thank you for taking time out of your busy schedules this afternoon to join us on this very, very cool webinar that we've got planned for you here. I do have CSG's very own Taylor McDonald with us on here today. I don't know if you've seen, but CSG Actuarial has been in the news lately in the insurance world anyway for a couple of different reasons. But one of those reasons is a brand new feature that CSG has rolled out, and it has to do with prescription drug data and pharmacy data and everything like that. So like I said, we do have Taylor McDonald with CSG on the line with us. And Taylor, whenever you're ready, I'm going to go ahead and turn it over to you. One quick note before we do that, though, which I always forget to mention, there is a questions box on the right-hand side of your screen there. So if at any point during the presentation you have a question on anything, go ahead and write it in that questions box over there. And at the end of Taylor's presentation, we will go ahead and address those questions. So Taylor, without further ado, I'm going to turn it over to you.
Thank you so much, Tyler, and thank you everybody, as Tyler mentioned, for taking time out of your schedules to learn today about this great new feature that's been released on the Western Marketing online quoting tool, which is the Medicare Advantage PDP and Special Needs Plan prescription drug and pharmacy lookup filter. So this will allow you to accurately compare the plan details, the drug pricing, the out-of-pocket estimates when you're doing these Medicare Advantage quotes. And so we're going to be walking through how you can actually do that. And not only can you add in these prescription drugs and pharmacies, but you can also save this information using this client manager feature that's also available on Western Marketing's online quoting tool. So we're going to start by running a new Medicare Advantage quote. So we'll simply click Run Quote. You will want to make sure that you use this, the tool that has that little green icon next to it, next to the Medicare Advantage tool. That's the new revamped version here. And then you have a couple different options with running this quote. You can either click from the client dropdown if you have clients that are previously saved in your client manager. You can click this dropdown and select any of your clients. Let's say I select somebody here, it will pull in their zip code, and it will also pull in any previous drugs that you've entered. So if I've run a quote previously for this person, it's going to pull in the drugs that we've already entered and their preferred pharmacy. So it will save all this information for them. If we don't have somebody, we want to run a new quote, we can just ignore this client dropdown and we can just do a quote from scratch, or you can actually pull in their information as I just showed you. So we'll enter the zip as we normally would. You will choose the county if it falls in multiple counties there. We'll want to make sure we pick the county that it fell into, that zip code. We can select our plan, so Medicare Advantage, Medicare Part D, or Special Needs, and then the effective year. We can choose how we want to sort the results by, so monthly premium, company name, meaning alphabetically, the annual drug and premium cost, or the annual drug deductible. So we'll just leave this as a default for now. And then you can also choose if a person has low income subsidy, you can choose what subsidy level they have, and that will be reflected in the results. And then here's that new piece. So prescription drugs, we can choose whether or not we want to add in a prescription drug. So we'll select yes, and then to pick our fill method here, we have retail pharmacy, mail order pharmacy, or both. And then to add the prescription drug, you'll just click add prescription drug. You'll notice that I do have one populated here since I pulled in a client, my client manager. This is one I've entered before. But to add another one, we would just click this drug here. We can start typing our drug name. We'll say it's Truvada. We'll just pick any random drug here. It doesn't matter for this example. We'll select the dosage, the package, if there's an option for the package, and then the quantity, so 30 tablets here, and then the frequency that they get this drug. So we'll say monthly. We can also toggle back and forth and choose whether we want generic drugs or substitutes in the search, or if we want to keep it as this brand name drug here. So then we can either go ahead and click add drug, or we can click keep open and add multiple to add multiple drugs, but we'll just say we're adding this drug in here, just a single drug along with the one that was previously entered and pulled in. Then we can choose our pharmacy. So this pharmacy here obviously is Shopco Pharmacy, and we can click here if we want to edit that. It will pull up the city that we ran the quote for. We can choose our search radius, how far they're wanting to go, how many miles, so 10, 20, or 50. And then we can select multiple as well. So you can just click if you want one pharmacy, or if you have a couple that you're open to, you can select more than one and update your preferred pharmacies, and then simply click add pharmacies. You will notice that Google Maps is pulled into here, so you'll be able to see any of the pharmacies. You can always zoom out in order to see the different areas that you're in. So go ahead and select the pharmacy, click add pharmacy, and it will be populated here. So once we've entered all of our information, excuse me, we'll hit get quote. And again, it will show our prescription drug here at the top, as well as the pharmacy we selected. And then we can choose, these look like they're saved here because I previously compared these quotes with individuals. So we'll go through that in a minute. But it shows all the drugs, all of the Medicare Advantage plans that are available. Obviously, the drugs are added in. So then it's going to show us the coverage. So we either have health and drug or health coverage. So it's going to list what type of coverage these plans have. It will also show which drugs are covered. So if there's a drug plan, it will show that we have 2 of 2 prescription drugs and they're both covered because I added 2 drugs in. And then it looks like this pharmacy is not in this network. So that's what that's listing here. We can scroll through and see it's going to show this for every single plan that shows on the Western Marketing Quoting Tool. So no plans are excluded from this. They're all going to be here in the results. And then we can click the show details. We'll just use this Aetna as an example. If I click show details, this will open up and it will actually show us all the information about this plan. So the health deductible, the low income subsidy, drug deductible, plan type, all of it is listed here for you to see. The retail pharmacy cost, obviously we had a very expensive drug and I think the quantity was very high on that one. So this is showing is very high right now, just the way that it was entered as an example before. And then it will show out also their Part B reduction, if there is one, the insulin savings program, and then also their drug coverage. Below this, we still have those market analytics. So we have the county enrollment, the company enrollment, if you want to see how popular a certain plan is in your county, or how many people are on it on the actual company as well. So we can see that information as we did previously on the regular Medicare Advantage quoting tool. And then if we actually want to dig down deeper into this information, what we'll want to do is actually click on the company name. So this will be on our quote results screen. We open it up, but then to actually see more detail here, we're going to click on that company name. So then what this shows us is our results here. We have a few different tabs at the top. So we have our overview. This is just showing us the plan information. And then the benefits and costs. So this goes through all the different benefits on this plan. As you can see, ambulance, doctor visits, emergency care, hearing. You can scroll through all of these different benefits. It's going to list those out. But most importantly, what you're probably wanting to see is this prescription drug coverage and cost. So it's going to show us what drug tier this is in. So for Trulicity, it shows it's in tier 3, Truvada tier 5, and it will show the preferred generic, preferred brand, all this information listed in here. We can also change the supply and it will change the information we see. So we can say maybe we want preferred retail pharmacy, maybe we want a 90-day supply. So we can change this and it will automatically update this information that we see on this page. It's also going to show us here the monthly cost and the cumulative cost. It will show the coverage phase that it's in. So if it, let's click show details here. It'll break it down by drug so we can see that cost. And then if there's a coverage phase, it will show that there. So if it's like catastrophic or what phase we are in, it will list that here as well. So I'm going to take us up back to the top here. We also have this carrier resources available. So it's going to have that carrier name and their address as well as the phone number. And then, of course, our website. If we ever want to see any further information or check out information on the website, we can simply click that here in the Carrier Resources tab. So again, we have these 4 tabs here at the top. Once we've clicked into this Aetna plan here by clicking on the carrier name, that's how we got here. Now I'm going to click this back button to go back to the quote results. And now if we want to actually compare multiple plans side by side, we will want to check plans that have the same coverage. So for instance, I won't be able to compare side by side this Aetna and this Humana plan because this one's only health coverage, this one's health and drug coverage. So if you're doing the side by side compare, you want to pick plans at the same coverage. So I'll go ahead and click this green or click this check mark and turn it green, and the plan will populate here up at the top. And then I'll also select this other Aetna plan. Maybe I'll compare this HMO to the PPO. So I'll click this check mark, turn it green. And then up at the top, you can see what plans you've selected. You can click this X if you want to remove them. Otherwise, we'll click compare quotes. And then you can actually see these compared side by side. So it's the same information as before. We have our overview, benefits and costs, drug coverage and costs, and carrier resources, but it's going to put these side by side so you can actually compare the information on the plan and click these tabs. And again, it's going to list them side by side so you can compare all that data, and you can do up to 5 at one time. You can always do a print or a save of this page by clicking this button at the top, or if you want to do the full list, you can always do that export as well here. Let's see, the navigation. So we will want to compare those if you want to print these out here. Of course, you can always just print your total screen, but to get that side-by-side compare is how we'll do that print and save. You can always do one at a time as well. So this is how you do the Medicare Advantage quote with the prescription drug and the pharmacies in there. They're all listed at the top. I'm going to take us back to the client manager or back to the dashboard and go to the client manager where you can see where you could see more client information that's pulled in. So back at the beginning, you'll notice that when we ran this quote, if we click run quote, you can choose your clients here at the top. So either I can do a brand new one and not add a client in if I'm just doing a fresh new search. But I want to show you how you can actually add in clients so that you can pull them in. So up at the top, I switched over here to the client manager, or you can go from the dashboard and click view clients. But you can either import client list here, you can click new, and we can add in a new client. So then we can add in their basic information here, their first and last name, their address, date of birth. So this is what all pulls in when you select a client from that drop down. And then when you actually run the quote and add those drugs is when it will actually save those drugs for them. So it makes it really easy for you to be able to run quotes year after year for your clients that you're working with and not having to re-enter that drug information every single year. So it will automatically be pulled in when you're running that quote. So it's a great new feature that's available here through Western Marketing Quoting Tool. We've got both the new prescription drug filter and pharmacy filter. And not only can you add in those drugs, but you can also add them in to your client manager here when we enter those drugs, and it will be saved for you year after year. So hopefully this is a great tool for you guys. That's all I have for the demo. Is there any questions, Tyler, that have come through that we want to address?
Yeah, absolutely. So thank you so much, Taylor, for doing that. As you can see, guys, this is going to be a really, really cool feature. It's just another way that Western Marketing and CSG are bringing you the most up-to-date and latest technology to make your lives a little bit easier, especially when you're running prescription drug plans and everything like that during AEP. So we do have a couple questions here, Taylor. I'm just going to go ahead and read them off to you, and I'll let you respond. So first question is, what is the difference between this and Medicare.gov?
Great question. So we are going in. We've gotten this question a lot. We are getting all the data from CMS, so it's updated all the time. One of the biggest things that's different from Medicare.gov is that you can actually save in these drugs. So we got a lot of feedback when Medicare.gov dropped their ability to save in that information and save the client drugs in there. So that's a big piece of why we wanted to be able to give you that option. So year after year, you're not having to re-enter those drugs. You can save them all in one place. But it is going to be similar to functionality. We did take that into consideration that a lot of people are familiar with using Medicare.gov. So we tried to make it similar in the user usability and the user friendliness. But a big feature is that you can save these drugs in your client manager.
Okay. Next question says, how many pharmacies can you add?
That's a great question. I'm not sure off the top of my head how many you can add. I'm sure you can add several. Let's take a peek here. We'll figure this out together. So we'll click Run Quote. We'll just go ahead and pull them in and see how many we can do. I know, you probably can add several here, a handful. Let's just pick one of our people. And let's try to add in a few more. We'll see. I know you can select several at once. Let's move our radius out a little bit. We'll click Load More. So I know you can pick several. I think I have 4 selected here. So it's letting me pick several. I'm not sure how many you'd want to add, but you could add some big names through the area. It looks like I've got 1, 2, 3, 4, 5, 6, 7 at least added here. So you can add several in, and you can really compare what the costs are going to be. So it looks like you can add several at once. I'm not sure if there's actually a limit. It might get a little bit more confusing if you keep adding more, but you can certainly add a handful as you see here.
Okay. Sounds good. Next question says, does the software account for pharmacy or carrier discounts when they apply?
That's a great question. I'm not sure I know the answer to that right off the bat. So I didn't see any discounts in there, and especially if it's like per location, I'm not sure if they'd be loaded in. I'm gonna assume not. But I will go back to my data team that uploads this file, and I'll see if there's anywhere in there that indicates, but I don't believe it does. But I'll double check and send that answer back to Tyler.
Okay, sounds good. There are several questions in here that are a little bit technical that the guys I'm not going to answer on here. I will definitely have myself or the marketer reach out to you on a one-on-one basis to answer those questions. Dave asked if we could still do like the fill the gaps. Yes, Dave, that's still available on the quote tool here. What we went over today is just a new feature that's being added to the quote tool. So everything that was there previously is still there. This is just another feature. Yeah, somebody asked that wants to know how
on the fill the gap. Yeah. Sorry to interrupt, but I do want to point out that if you want to use the fill the gap, so we're revamping how this is worded here. We wanted to get this tool out as soon as we could this year. So it looks a little funny how it says V2 beta here. But something I do want to point out, if you want to do the fill the gap how you used to be able to do that, you'll want to use this original version. So this V2 beta here is what you'd use for the prescription drug or the pharmacies to add those in. But if you want to do the fill the gap to the hospital indemnity, make sure you use this original one that doesn't have that new green icon here. You'll want to use the original Medicare Advantage tool. So that's something to point out. There's kind of 2 tools. We're working on combining them, so then it will all be underneath one. And not so tricky there with 2 of them. But if you do the fill the gaps, you want to make sure you use this older tool or the original tool without the green.
Okay, yeah, thanks for clearing that up for us, Taylor. Sure do appreciate that. Next question says they want to know how the client list and the drug lists are safeguarded.
As far as your data, if that's what you're asking, as far as if it's safe in there, this is all protected in privacy. We have privacy measures in place in CSG so that nobody else can see your client's drug or their information. We're actually working on updating our terms and conditions so that will be in there, and it will explain that we do protect this data. So no client data, such as anything about your client or their drug, ever leaves CSG. It's all protected in there, and we have security measures in place. So we'll be updating that terms and conditions so that you have that in writing and you can see that all your client's information is safe here in the tool.
Okay. And then looks like we got time for one more here, Taylor. And then, like I said, if we didn't answer your question, I do apologize. There were a whole bunch of them that were pretty technical and can be answered on a one-on-one basis. So again, if we didn't answer them, we'll reach out to you and make sure we get those answered. But the last question here, Taylor, it says, didn't look like a new client was added when you ran the demo or that the client was saved at the end of the quote. How do you make sure that the new client is added or saved to your list?
Great question. That maybe got a little bit tricky when I did that, because when I first ran the quote, I actually pulled in a client that I had already created. So up at the top, I didn't type in a name. I just selected this first one here. But I can, and to create a new client here, I could also do that. So if I just say like test, I'm just going to do test, just straight up test. Actually, I think you will have to create them first. So in order to run a quote, you would want to create the client first in your client manager, and then you can pull them in. If I just run a quote without pulling them in, it's not going to actually save them. So this person wouldn't be saved because I didn't select anybody here for a client. You would want to add your client first in order to pull that name down, and then it would pull in their whatever drugs you enter would actually save for this person. So if you don't select somebody, it's not going to save this. You'd have to create the client first in your client manager in order to select them from the drop down. Hopefully that answers that question. If not, feel free to ask again or ask a follow-up question.
So basically go to the client manager tab, create the client, then pull them from that drop down and run the quote.
Exactly.
Okay. Got it. Jeff, I'll make sure we go through that with you since that was your question there. Looks like that was the last question. So I know everybody's busy this afternoon, so we'll go ahead and wrap this up. Just FYI, this was recorded. I will send out an email here shortly with a link to the recording if you guys would like to go back and review this again. Thanks so much for your time today. We really appreciate it. Taylor, thank you so much for taking time out of your day to walk us through this. We certainly appreciate the partnership with CSG and with all of you guys that write business with us. So if you do have any questions, give us a call, 800-852-7152. And thanks again.